Sir, so today, first let's talk about the types of the wound. First is abrasions. Abrasions are usually the result or rub or scrape on a rough surface like skinning your knee on the playground or scratching your elbow on a brick wall. Sometimes people call abrasions strawberries or raspberries. Typically, an abrasion will not bleed heavily, but the area should be thoroughly cleaned and washed with soap and water to avoid infection. An abrasion may require a bandage or dressing in extreme cases, but minor abrasions should heal on their own after cleaning. The second one, lacerations. Lacerations are cuts, slices, or tears in the skin. Lacerations are often caused by sharp objects like knives or broken glass. Bleeding may occur quickly in the cases of deep laceration, so it's important to stop the bleeding by covering the wound and applying pressure. If bleeding is severe or won't stop, you may need to proceed an emergency room or call 911 for additional medical attention. Third one is punctures. Punctures can occur when any type of pointed object such as nail penetrates the skin. Puncture wounds may not bleed much outwardly, but a deep puncture can cause internal bleeding. Apply pressure and rinse the wound with clean water to remove all dirt. Before drying and covering with a bandage, apply antibiotic, cream, or ointment, and watch the puncture for signs of infection, such as spreading redness, pain, swelling, or fever. Tetanus, that's what the exact word. Tetanus, if the person with the injury has not had a tetanus shot in the past 5 years, a booster may needed it best to get this within 48 hours of injury. Fourth one, avulsions. Avulsions are severe injuries that can cause uncontrolled, life-threatening bleeding. This type of injury typically occurs when the skin or body parts is partially or completely torn away. The first aid for open wound. Then, how to treat the first aid of open wound. First, rinse the cut or wound with water and apply pressure with sterile gauze, a bandage, or a clean cloth. If blood soaks through the bandage, place another bandage on top of the first and keep applying the pressure. Raise the injured part to slow bleeding. When bleeding stops, cover the wound with a new clean bandage. So, the types of shock. Types of shock is cardiogenic, which is due to failure of the heart. Hypovolemic, due to increase of blood volume. Distributive is caused by excessive vasodilation and impaired distribution of blood flow. Treatment for shock. Lay the person if possible, begin the CPR. If necessary, treat obvious injuries. Keep person warm and comfortable. So, let's talk about animal bites. Animal bites and scratches that break the skin can sometimes cause infection. Some bites need stitches, while others heal on their own, rarely. Rarely, bites from wild animals can lead to rabies, a life-threatening infection. Bats, raccoons, skunks, and foxes cause most rabies cases. So, snake bite. Snake bite, when you get bitten by a snake, the first thing you would do is immediately wash the wound with soap and water. Reassure the victim to calm and still immobilize the bite area with a splint, and lastly, venom can be injected to the patient. Dog bite. First, wash your wound thoroughly with soap and flowing water. Wash the hand also after cleaning the wound to avoid infection. Cover the wound, antibiotics, ointment, and bandage. Lastly, consult doctor for further treatment as you may need to inject or shot anti-rabies. That's all.